A patient arrives at the clinic with signs of a respiratory infection. During the patient interview, you learn that they recently attended a crowded indoor event. The patient mentioned they often touched their face without washing their hands and shared food with others at the event. Several other attendees have reported similar symptoms. What measures should you take when taking care of this patient to prevent the spread of infection to you? Wear PPE. Wash your hands before and after interacting with the patient, proper cleaning of the room used, and proper disposal of PPE after treating the patient. What can you counsel the patient to do in the future to prevent getting sick? Vaccines for preventable diseases. Washing hands regularly. Do not touch your face or open areas of the body until your hands are washed and clean. Not sharing food or drinks with other people. Consider wearing a mask if you see fit to prevent the spread of respiratory diseases.